attending this meeting because the date has changed? Or would you guys suggest, should we wait like 5 more minutes for more
No.
people to join us?
You snooze, you lose. Wait, some of us have to leave, so.
Sure.
But we have to go do the next program.
Yeah. All right, so I'll call the meeting to order. And before we start the meeting, let's do a quick round of introductions. We'll start with the person on the phone. Hi, Dara, could you introduce yourself?
Sure, my name's Tara Fleury. I'm the outreach coordinator for the EOCCO Personal Health Management Program through Health Integrated.
Thank you. My name is Arvinder Singh. I am the CHIP coordinator for Lake County, Lake Hill District.
I'm Janine Sims. I'm the care coordinator nurse / population health nurse for the clinic.
I'm Susan Campbell. I'm the clinics manager for Lake Health Clinic and Lake Health Specialty Clinic.
I'm Francie Winters. I'm the prevention coordinator for Lake Health District covering the county.
Do you want to introduce yourself?
Do I want to introduce myself? I'm Garrett Shaw. I work for the Lake County Examiner.
Thank you.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Kristen Hill, I work for the hospital here. I'm the new facility patient navigator.
I'm Christy Almerson. I am the grant writer for the health district.
Thank you. Hi, has someone joined us over the phone?
Yes, this is Kathy from Christmas Valley.
Hi, Kathy. Perfect time. We were just doing introductions. Could you introduce yourself?
I'm Kathy Pike. I'm the Outreach and Enrollment Advisor for Alliance Community Health Center in Christmas Valley.
Thank you. So let's take a few minutes to go over the July minutes. Do I have a motion to approve the minutes?
I move to approve the minutes as presented.
Do I have a second?
I'll second.
Thank you. All in favor say aye.
Aye.
All who oppose say the same sign. So thank you, the minutes have been approved. So we'll start with our agenda. There was a mistake on my side. I did not add Paul's agenda item. Do you want to go with your item?
Yes.
Data.
Christy had suggested that I contact Troy about what the decision was on funding at the EOCCO board meeting. He said, give me a call. So
Okay.
if you can do that.
Yeah, I can start with-
I can try to get this information for you all.
Yeah, I can start with the chip updates and
Thank you. Sorry.
so is everyone enjoying the beautiful weather we have been having for quite some time?
Yes, it's nice and cool at night and it's nice and warm during the day. We just don't like the smoke.
I wonder if it's going to affect the town fair.
I don't know, but we've done a lot of nebulizer treatments.
Yeah. A lot of what?
Nebulizer
Oh,
treatments,
yeah.
people can't breathe.
Yeah, I have asthma, so I struggled a bit, but.
And do we know till when this fire season is going to go on?
No, I remember last year that during the rodeo, there was still smoke though.
I'm told with
remember
the
that.
fire that it should be through, going through October even this month.
Oh, wow.
Like,
I have heard
so
that,
there's
yes.
snow to put out the fire.
Yeah. Yeah.
Snow.
Yeah, you gotta get the fuel just enough to not burn.
Yeah.
So as I mentioned, there were a lot of cancellations on the agenda today, so we'll be having a short and sweet meeting today.
Okay.
Hopefully nobody's offended by that. Yeah, don't want to exhaust you guys, you know, indoors when there's barely any air to breathe outdoors. So I'll start with the chip updates. Hi Diane.
Unedited.
You did. So I'll start with the developmental screening incentive measure. So since March of this year, we have, we meaning the Lake Health clinics, the Warner Mountain Clinic and the Pine Clinic at Christmas Valley. Together we have handed out more than 55 cases of diapers to mothers. I just thought I'll share that with the council. And yeah, and the program is still going strong. For the summer food program, despite the poor air quality, we have still been doing good numbers. We have had a couple of days where we shut down the outdoor sites, but we have been serving out of the library, and we have also been serving food at the elementary school. And today, we also serve lunches to kids at Christmas Valley with the help of OSU Extension folks. So I think that's good, and there was discussion of expanding the summer food program in Christmas Valley. So I'm in talks with Mr. David Kerr, and there are ideas of how we can provide lunches to kids in Christmas Valley. We can definitely not serve lunches at the North Lake School because it's not accessible for lots of people who live in Christmas Valley, but there were suggestions of doing it in Silver Lake and some other sites. But yeah, I'm just giving an idea. There's still a lot of discussion to take place.
I thought that there was a problem with the USDA grant that they would.
Yeah, if we can make that happen, it would be a huge deal because the map that we're based off of from USDA shows that it's just the little southwest corner of Lake County is where we can serve meals, which the northern border on that map is Old Smoky Road or whatever that road is called. So we can't go to Valley Falls, we can't go to Paisley. So if we can get some kind of workaround to serve, we got special dispensation today because of this event that OSU Extension was doing already. The State Department of Ed let us serve up there thanks to our vendor working with OEE. It'd be a huge deal if we could do it in North Lake. The need is so much bigger there. One of the things they look at is the number of kids who qualify for free or reduced lunches, and we're not even quite at 50% in Lakeview, and we are allowed to serve in Lakeview. North Lake is closer to 75%. So the need is there, they're just so spread out, and that is why we haven't been allowed to serve there to date, so, sorry, thanks.
So for the prenatal postpartum incentive measure, so we have started the program, and since the time it has started, we have handed out 12 $50 gift cards to mothers.
Is that just prenatal, is it prenatal and?
So it's actually six gift cards for prenatal and 6 gift cards for postpartum.
Nice.
And again, I just wanted to remind the council about the teen health fairs we will be conducting in Lake County. So the North Lake Health Fair is going to be before the Lakeview Health Fair. That's going to be on October 3rd. I'm glad that the fair is indoors, otherwise we're going to have smoke during the health fair. And the Lakeview Health Fair is going to happen on November 7th. I have been in touch with the Paisley School because there were plans that they will bus kids from the Paisley School to the Lakeview Health Fair. Last CHIP meeting, we had discussion about how we could accommodate, how we could get those kids during the time of the health fair. So I'm in touch with the principal of the Paisley School, and he has said that he can get permission from the teachers to release the children before the school ends, but he has to get back to me with confirming that. So I think last CHIP meeting when we had discussed, that was the best option if the kids could leave the school earlier and get to the teen health fair. But there's still a lot of discussion we need to do if we want to do grade-wise, the students need to attend it, or yes, and so already There's a meeting underway with the North Lake Health Fair. I'll be sending out an email soon to the participants in the Lakeview Health Fair, and we can go over that.
So it was my understanding we were still in negotiation over the 7th. If we do it on the 7th, we're not going to be able to do the immunization piece that we did last year. And the reason why we can't do that is because we won't have access to the parents to give us the insurance card, to give us the okay, sign the consent, to order in all the immunizations that we know are due. That was the night that we had access to parents to look up all the immunizations, to pre-do all that. And that being said, just as long as you guys know that that piece will not be there, because there's no reason for me to take immunizations if I don't have parents' insurance cards. Right? It was 96% kids, no parents that came. So they can't do it. So I think we lose a huge opportunity to have no school exclusions like we did before.
Right.
I mean, I gave 180 some HPV vaccines that we have only given like 30 in a year. It's a missed opportunity if we don't change that date to later.
So what date would you prefer?
I can order, if we can, on the 7th is the day that we can get parents' okays. I can, if we got all those on the 7th, we could count that up, say the 8th. I can place an order. It takes about 2 weeks to get in the immunizations.
Okay.
That being said, it doesn't even matter at that point, that I can pre-order in a large portion because we can't give them all that day. There's no way possible to make it through. So knowing that we have the paperwork, then I just went back to the schools and called kids out and gave it. So I don't even have to have all the immunizations. It's just all the paperwork, all the okay to do that. So theoretically, we could do it even the next week with the thought that I would just pre-order a whole bunch anytime after that day, because that's our access to parents.
Is that what is happening on the 7th? Is that patient or
That's
conferences?
conference night, yeah. So and that's the first night. Let's see, when are conferences? Conferences are usually, it'd be Wednesday, Thursday, and then the teachers get the day off Friday. So Wednesday and Thursday would be conferences, those 2 nights. So you would also, we'd get more parents on the 8th also, so the 7th and 8th, parents come. We catch them last year, and I'm gone that week, and I was gone that week last year too. But Jill's here. What they did is they had the computer, each parent came up, they looked their kid up. We pre-looked them up, actually. They
didn't have a computer.
They had us, well, it's always cross your finger. We worked with the school and they gave us birth dates and names. If we don't have birth dates and names, we can't pre-look up a birth. They were kind enough to give us those. And so we were able to print out every kid. So when a parent came up, we said, these are what your children are due for. Are you okay with that? They initialed. And do you have a copy? They allowed us to use a copier so we could get insurance, or we could handwrite it in there if they had just a card and didn't get a copy. And then that allowed us access at any time after that. We would say, absolutely, we're giving those shots. It will be over this period of time. First come, first serve at the fair. We worked nonstop. I mean, I didn't even look up and didn't realize everybody was gone and packed up because we were behind a thing. So we'll bring one other nurse this time, so there'll be 3 of us doing the shots. And even that being said, if it's as successful as it was last year, we won't get through with them, and then I'll follow up with the school and make appointments that I just go set up camp and call kids in one at a time and finish them up. I just think it was, and so what will happen is the kids who got their first HPV, this will be the opportunity to finish it. We don't get those kids in anymore. They're not required. After 7th grade, they've met all the requirements for school. So this is the opportunity to grab them and finish that. Otherwise, we miss that, and they're never complete, and they don't count that. We don't get that statistic until they've completed their series. It doesn't matter if they've had one. So next year, we should see a huge boost because we'll have finished them. I'm just saying, of course, it's selfishly, this is a huge opportunity for immunizations, and it was fabulous last year, and I would hate to not have that opportunity to follow up with people again.
But that's like one of the big things that we're looking to, for data driving is.
It's not an incentive measure.
It's
No.
it's not really,
It's
but
an incentive measure.
It is, but not,
That's purpose, right, for EOC.
The grant-
Well, for EOCCO,
It is,
it's
yeah.
about 2-year-olds. People who
Yeah.
turn 2 and are fully
Oh, okay.
immunized. The HPV is,
so it's just a part of the wellness
Right.
visit, it's not, okay.
But it's an important thing.
Yeah.
it is,
Yeah.
yeah, it's important. What, the question that I had is now that public health is part of like health district, would we be able to allocate a couple of additional RNs to help you do those vaccines and maybe get through all of that? So-
that's the beauty of being under one organization.
Yeah.
Right. So I just wondered if I could
Yeah. as
kick
long-
over a couple people to do that.
So I can definitely speak with the school district and get more dates
Uh-huh.
for the
I
date.
I would appreciate that. If absolutely it doesn't work, we can do reproductive and tobacco. But, yeah, my passion is immunizations, and it was so wonderful last year. I was so looking forward to being able to continue that.
Yeah, I don't think we would want to lose out on that.
Yeah.
So,
And, because I've thought, and it really doesn't work to take things there because you won't be able to give them. So I didn't go to, this is the first year we haven't gone to registration because parents don't come anymore, they do it all online.
Yeah.
I was able to catch people before that way. Last year I got like 3 people had a parent and I
yeah,
was able to give shots, but it's not worth me going and sitting there the day.
yeah. I think even I and Susan were there last year and we faced the same problem
Mhm.
because no parents were showing up.
No parents are showing up, yeah.
No, we were more successful at the registration.
Yeah.
We made lots, I probably made 30 appointments at registration.
Mhm.
So yeah, so let me speak with the school district and get back to you soon. Anyways, in another 2 weeks, the next CHIP meeting is gonna be there, so I should definitely have the dates by then.
Okay. As long as I know, see, the thing is, with vaccines, if I order them in, I pay for them and I can't send them back. So I certainly do not want to order a whole bunch of HPVs if I'm not going to have access to those parents that are going to say, okay, because we will eat the cost and they're $180 some. We cannot, I am scared to over order what I can actually give. So I'd rather be hesitant, order some, knowing that, and the immunization program worked really well with me. I'm allowed to order once a month, and I probably placed 3 orders that month, and they were excited about that, because we've never given that many. So they will work with me, so as long as I can get an estimate of numbers, then I can just start ordering, and we just will make it happen.
Yeah.
And we gave flu vaccines at that time also, we did the flu shots for the kids at the same time.
And you plan to order those vaccines?
I order the first of every month,
Okay.
and so I'm gonna order a bigger amount this month because we have some kids already coming in to get their school requirements. And knowing that we have the other teen health fair coming up in October, they expire in like a year.
Okay.
So I feel comfortable ordering quite a few now just to get us started, and then I can order again. I'll just tell them I won't place my order until the end of that second week,
Okay.
and then I can get a better idea and order more. They'll work with me. I just don't want to, I'd rather order too few, knowing that I'll follow up with the school and keep giving them than too many.
Okay, and you said the week after November 7th would be good for
I
public
can't
health?
see why that wouldn't work for
Okay.
us. No, I can't see why it won't work for us because I will be prepared this time to get more vaccines. And even if like I said, if I didn't have enough, I have enough to get started, knowing that I'll get more quickly.
Okay,
Because I'll know how many to order.
yeah. So
And I
I'm-
don't have to wait for parents, I just go to school and pull a kid out. They've already signed saying it's okay. So that's the beauty of it, is the convenience for parents.
Okay, well, thanks for letting me know, I've noted it down, and let me work on different dates.
Okay.
Is everyone else who's gonna be there for the teen health fair fine with a week after November 7th?
I think that works for us. I would like to be able to be at parent-teacher conferences like we were last year. If we can arrange for that, I feel like that was a good kind of icebreaker for that. And I think now that we've done it for a year, people will they'll know what's going on and they'll be looking for us all to be there
Yeah,
for that. So I think
Yeah.
it might be even more successful.
and I'll be accompanying you again. this
Awesome.
year. Yeah.
And if we have, do we have swag still, or do we need to get that ordered?
So I have ordered most of the swag for the North Lake Health Fair. There's still more items to order. I haven't ordered much for the Lakeview Health Fair yet, and that was the next discussion I wanted to briefly have with the council. So for the North Lake Health Fair, the swag items are like pens, drawstring bags, stress balls. They had an idea of also providing exercise stretch bands. It seems that's kind of popular. And we have still a lot of fidget spinners left from last year, so we'll be using that. Does anyone have any
Not
suggestions?
syringe pens, right?
That's what I was just gonna ask.
Yeah, so Francie brought to my notice that, so during the Daily Days Health Fair, we had these fancy syringe pens, which were very popular, and we handed out to a lot of kids, and later we were reflecting on that, and we were like, that was probably not a...
It's like the candy cigarettes?
Exactly, yeah.
Yeah.
So we felt that was kind of inappropriate, and we don't wanna, yeah. So-
And the exercise tubing?
Yeah.
Yeah. Yeah,
Yeah.
No, I mean,
Yeah.
well,
No,
it
yeah.
depends on what they're using it for, right?
Can't you win or losing, huh?
Stress balls are always good.
Yeah.
Yeah.
You can't even hurt them.
Yeah.
We need many daters.
Yeah. Are there any other suggestions for swag items that,
I think the fidget spinners went over well last year. I'm trying to remember what else we had.
is there a new toy that's
Yeah, I was gonna
trending?
ask our fidget spinners still.
Yeah.
I mean, I wouldn't order any more, but I think you'll use what you have. I think stress balls are kind of a good thing usually.
You have kids. What
I
are
know,
your
I'm
kids
trying to
into?
think of what my kids are. Yeah, my kids went crazy over that moon sand or whatever.
Oh, yeah.
That was a big deal.
Yeah.
Is it that silica sand that doesn't?
Yeah, it doesn't go everywhere. It kind of sticks
Yeah.
together and it's a sensory thing.
Our kids walk and bike a lot. What about the, like, the stuff that they, the fluorescent stuff they get from,
Like stickers on the,
yeah, or they get like, I can't talk.
Excuse me.
attached to the wheel?
They're,
Reflectors?
yeah, they're like reflecting shoelaces.
Yeah.
Shoelaces.
That's not what you
Charades.
I know, it's like riding the bicycle fast. What are we doing?
It's the smoke, it's the smoke.
Yeah.
I'm getting another oxygen.
The pedometers that we had some left over from daily days. The pedometers went over really well too.
Uh-huh.
And those encourage exercise.
Okay. Nice.
The people that commute, you know, the commute people, they had those. They gave out those great things for the bicycle people where in the.
They were lights or something like
Yeah.
that, like you had to turn them
Yeah.
on.
Yeah, just a bunch of cool stuff like that.
There's
Those are spendy.
reflectors for your helmets too, that are just
Yeah.
stickers. If you look up traffic safety
Yeah.
and then look for swag in that, there's a bunch of things that, like Francine's talking about for bicycles in particular, and pedestrians too, so there's some.
Yeah.
Did we decide, it's been a long time since we had the planning meetings. What did we decide on the big ticket items were gonna be this year?
Yeah, so for the North Lake Health Fair, the big items are a Fitbit watch, passes for archery hunting, and they were fine with either big amount gift cards or bikes. We did bikes last year, one of the prices. So that's another thing I wanted to ask. Do we want to stick with bikes or the ski passes? Or do
Well,
we
down
wanna-
here, Christy asked us to talk to the kids down here, and our park leaders brought up that,
Nice.
that the bikes and stuff were good and healthy, but they were really, all those things were really directed more at outdoorsy kinds of kids.
Okay.
And they weren't encouraging to the people who were more brainiacs. And they brought, up, you know, I said, so what would you rather have? And they're like, scholarship money, and they brought a bunch of
Didn't they
stuff that
bring
you
up,
got.
like skiing was for people who could afford to ski?
They might have.
Well, it
Biking
came
is
with
more
rentals
general.
and stuff.
Yeah,
Yeah.
and
But
there was
I-
added cost to it that they wouldn't be able to afford.
Yeah.
Yeah, so I don't know.
I think the ski passes were kind of rough, well, mostly because we had no snow last year. I mean, I know they carried them over
Yeah.
for this year, but I feel like more kids, at least at our clinic, more kids entered in the bikes. I think
Or what about, just plain old gift cards? They
Yeah.
love gift cards.
Yeah, they can pick out what they want.
part of our thinking was encouraging the healthy lifestyle.
There you go, yeah, you got it.
Because we're
You got it
measuring
Yeah.
measuring childhood obesity and
Right.
that BMI, so
Yeah.
I think that's why we leaned towards that as a committee last year. And even if you are kind of more brainy, you're still
Yeah.
like encouraged
I
to.
agree, I'm just giving.
I think that's why we
Yeah.
chose that last year, because we talked about an iPad or a, Apple or like an Amazon Fire or something like that, but we, I think we leaned towards the things that were more outdoorsy and that they would be exercise driven.
Swimming event, maybe a swimming pass for the pool. or
Yoga,
something.
mat, gear, I don't know.
I don't know.
Shoes?
But yoga, I looked into doing yoga, it was $8 every time you went.
That's because you're not coming to the right class.
That's what I'm hearing.
Yeah.
Well, I didn't go to that class either, because I had to do it so many times I couldn't afford it.
Yeah.
Yeah,
Our class is free because we're
Yeah,
grant
there's
driven.
another one coming up.
well, there you go.
Yep.
Okay.
What about Fitbit watches for Lakeview Health Fair?
We didn't do that yet, right?
No.
No?
I think a Fitbit would
We
be,
still like it,
Yeah.
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 So Fitbit watch, could they work if you don't have a smartphone?
Yes.
So, and the people who apply for it, put their name in it, they obviously have it, right? Okay.
Right,
Yeah.
they picked, there's like, last year we had
Okay.
four bins.
Okay.
And they picked, and the Fitbits are nice because they are, they can be used in just like a pedometer or heart rate, just a fitness tool, or you can link it up with your smartphone or whatever. So I think they aren't,
So there wouldn't be an added cost to that then?
right?
No, I don't think so. Yeah, and you can definitely use it without a smartphone.
Okay.
Any other ideas, or we'll go to the next agenda item? This is good enough for now. So, the living well classes, Francie, can you or Jenny?
Let's
who's
do
the
it.
lead?
Should be her, right?
We're starting the chronic disease self-management program on hypertension and asthma and COPD. We're starting that tonight at 5:30 to 8 at the senior center. So we're very excited about that new class. That's a spinoff from the Living Well with chronic conditions. That's one of the specialties. And then we are starting chronic pain self-management September 27th. And that'll be another 6 weeks course that starts at the senior center as well. And I'm still doing the diabetes support group, and that's going well. We still have our core membership of about a dozen. This time, we won't meet because of the holiday. So we'll meet again September 17th, but this time we're going to have Amy Hussey, who's a physical therapist, and she'll be talking about any kind of complications that you may have with diabetes and how it affects like ambulation. We'll also have her talk about falls, because many of our members are middle-aged or elderly, and some have difficulty with ambulation. So we'll have her come and speak to the group about that. So we're looking forward to that too.
Thank you.
Mm-hmm.
And our food co person is going to be back next week. Brooke Kelleher has signed to continue another year in Lakeview, which is amazing. We get a lot of work done with the schools. Christy, do you have any?
So the quick stuff, we're still waiting to hear on a number of grant proposals that we've submitted. One that would help purchase some AEDs for the hospital. One that would support the Outback Strong Fresh program, which is the teaching, it's offering SNAP Ed, but we can't call it SNAP Ed because there are hoops that come with SNAP Ed that we don't want to jump through. But offering that kind of healthy cooking, healthy grocery shopping, healthy living kind of classes, and getting the community garden up and running, and really addressing the food insecurity in Lake County is kind of the heart of that. And then we're waiting to hear about the opioid planning grant that we submitted to HRSA. So we should know within the next few months on those, but you just never really know when you're going to hear back. We did, help me out, clinical people. Eddie, is that the EHR?
No, that's,
It's the
well,
emergency room.
it's the emergency
Right.
room, which it pairs with pre-managed.
Okay, so we are working on upgrading that so that we can do all of the integration that needs to happen that I don't understand because I don't need to understand. And we're gonna be able to get reimbursed from part of that through a state foundation, which is fantastic because it is crazy.
Part of the importance of that is once we upgrade the PDMP verification, which is the controlled substances that are being prescribed, will actually automatically pull in with their EDI report, so they will know if they have a pain contract with anyone, or what opiates or benzos that people have been prescribed. So that's an important reason why we need to upgrade it.
We got $1,000 from ODOT recently. And we get money just about every year. We apply for money for them for our car seat program that Abby Finetti does. And so we recently spent all of that and then some, so Abby has 29 more car seats and that program is going strong. So, you know, anyone with littles in car seats?
Yeah. How, I'm trying to think of a good way to make either adding that to our OB checklist or something, some way for people to know that that's available, because I forget that that's available.
It's on the
Is it on the checklist that they have somebody check their car seat safety?
And unfortunately, I think Abby is the only one.
That's
Yes,
just
right,
right.
she's our
Yeah.
only CPS, yeah.
I just forget that there's.
And she has had a huge influx of checks since the program's been
Yeah,
initiated.
yeah, and we have lots of OBs right now.
Yes,
Holy
you do.
moly, a lot of delivering in August. So, lots in June and lots more in August.
Including my nephew, sorry. Because he's perfect.
Make sure that's reflected in the minutes.
I'm sure I will. So summer lunch program, our leader talks about how awesome it is this year. And I know that we're still going, but it's not too early to start thinking about 2019. So I have a sign-in sheet or a sign-up sheet if you're interested at all in helping plan for next year. We had some issues, the smoke of course being a big one, and trying to kind of fly by the seat of our pants and figure out how to still serve lunches, not put volunteers' health at risk by making them sit out in the smoke. So that'd be one thing we would be talking about for 2019, because probably this is just going to be a problem moving forward. Talking about volunteers and how to recruit more people. We've had some issues, we talked about that at the last CHIP meeting, just about getting volunteers to follow through. And you guys all know this because you are people who show up at all the things. They're in everywhere you go, there's a core group of people who want to do everything and we burn ourselves out. So how can we get the community to really buy in and support the program and give their time? So sign-in sheet going around for that. The other thing I wanted to mention, EV utilization. So that is one of our grants. Our vendor is not overseeing that one. That's one of the few. Doesn't have to lead. NOM is the lead on that, but that's one of our EOCCO grants to help reduce the number of people who are inappropriately using the emergency department when we have clinics and behavioral health and other resources that they should be using instead. Our grants depended on having a navigator, and so we have not received any funding for it, couldn't do anything until we hired a navigator, so now we have Kristen and we can move forward, so that is really exciting, really exciting. Okay, so the last thing also has a sign-in sheet. The Lake County Older Adult Collaborative, we meet with Rod Harwood, he's usually down here to coincide with the CHIP meetings, but we had to push this one this time. But so we meet the second Thursday of the month in the mornings. And one of the things we've been talking about there is the Villages program. And it's a national program. And the idea is in your community, you create a pool of volunteers, some skilled and some not, who can help seniors age in place. And so we're working with Klamath and Lake County's Council on Aging to get this going in both Klamath and Lake counties. And Klamath is a little more ahead of the game than we are. They have a mission statement and they're moving forward with putting something before commissioners or whoever needs to bless this thing. And they're kind of setting the template for us, but we'd like to create one in Lakeview and probably one in Christmas Valley as well. It makes sense to have two groups in Lake County versus trying to have a Lake County-wide Someone who signs up to volunteer and lives in Lakeview isn't probably going to be available to go to Parsons Valley. So again, like I said, skilled people, we're looking for carpenters, plumbers, electricians, people who have those kinds of skills and can help seniors make small repairs. And then non-skilled people too. Rod has mentioned this several times at these meetings, that isolation kills as many people these days as tobacco. So we have a lot of people in our county who are just alone. Their friends and their family members have died or moved away and they don't have anyone to talk to. So even if you have no skills, I'm not someone who has any kind of handy skills, but I could sure talk to someone or help them clean their house or take them to Safeway. These are people who maybe don't qualify for federal assistance, but still need help. So I have a sign-in sheet here. If anyone is interested in finding out more or signing up to be a volunteer, you'll write down their name and number and or any skills you might have. That would be great.
Thank you. And also another thing for next year's summer food program, we need more men to participate in the program. Yeah,
Speaking of estrogen.
in all the programs, there's very few participation from Lakeview males. So yeah, we should also work on that. Bathe them. And before I end the CHIP updates, one last thing. So there's an international dinner club that's starting in Lakeview. There's a flyer in the packet that you guys have. So the idea is that there are lots of minorities or communities that do not meet together that much or do not share information, are not that big of a part of the Lakeview community. And because of that, they feel that they have missed out on some opportunities or so the first international dinner is going to take place tomorrow at 6:30. And if you guys could spread the word around. And I think when I and Francie had spoken to the lady, she had said that they will see how it goes tomorrow. And then they will see if they want to do it every week or every month. And so if you guys can pass on the word, I'll see if I can make some copies and put it up on bulletin boards around town and have a larger attendance. Does anyone have any questions or comments?
Potluck, right?
Yeah. Again, I don't know if that's gonna be the thing for all the meetings,
Right,
but for the
yeah.
one tomorrow, they have asked to bring one dish. Yeah.
Bring a dish and a friend, it says now.
Yes. Did you hear about this?
Yes,
Oh, nice.
I was there, never mind.
You can share with us, Diane.
No. I can't get into any more things. I'm falling.
Too much on your plate, yeah.
Yeah.
Do you wanna go next, Paul?
Sure, and I'm sorry this is a verbal report, but the Eastern Oregon Coordinated Care Organization Board of Directors was meeting as I was driving down here. And I got the information about some things that I'll share with you. The important one is the local community advisory council monies have been approved, so you'll probably get about $2,000 more than you got last year.
Okay.
The stipulation this year is that in a range of between 60 and 70%, you're pretty much free to do what you want to do with it if it's linked to your CHIP plan. And 30 to 40% must be addressing at least one incentive measure. So that bigger chunk of money, you're pretty much free. And
Cool.
that's where we can do things with social determinants of health. There are no other areas within the settlement redistribution that are going to allow that until we are better, as the minutes reflected, until the Oregon Health Authority tells CCOs exactly what they must do in social determinants of health. So this is just kind of a free-form area. This committee that I served on that sent the report to the board also recommended We did not get an agreement for a per member per month payment to public health. But what we compromised and is going to the settlement redistribution group is, and it was approved today, is that $250,000 will be set aside that only public health can go after.
How much was that?
250. So those are the two big ones that came out of the meeting. You'll see written information on that as it comes up. So that's good. But many of the other policies are going to be re-emphasized stronger. No overlapping proposals, even though that was pretty clear last year. There were still a couple of places that linked opt-in grants with LCAC grants. And one of the potential solutions is submit the LCAC grant first and then opt-in grants later.
We didn't have to submit all of them at once. That would be really good for grant writers.
Right, but it would also split them up, you know, so that you couldn't link them in budget by saying, we're going to use a piece of this ED grant and also have this person do X, Y, or Z in another grant. They have to be distinct. And the adolescent child portion of the opt-in funds was pulled out of the recommendations today for further discussion. There was just some questions about doing things during clinic hours versus all of it being discrete events outside of clinic. So I don't know what's going to happen. It'll go back to a subcommittee at that point. But know that the money's there. Start thinking about what you want to do with it, linking it to your CHIP, your community health improvement plan, or incentive measures.
Just as a heads up, I'll be trying to get people together probably starting next month, October at the latest.
Right.
Because it's a killer to try to do all of the grant proposals and think all those through.
In December, it's terrible.
It's horrible.
When
So
you have
we
6 or 8 of them, I
Right.
can't even imagine what you do, but I know that the 6 that I sat in on were a blur.
Let's knock out the
Right.
LCAC early.
Well, it's good that the Lake Health District has an umbrella organization, but that puts them all on you. In another county where there's separate public health, separate mental health, separate primary care, those people are the ones that are writing one of those grants. But this, in your case, I feel for you, but your situation is fairly unique in terms of the ability, but it also gives you the ability to weave things together much better. So,
But with that said, it's really important, since we aren't all having to do it separately, on our own, and we have the great asset of having Christy, that everybody gets her the information that she needs when she needs it and pays attention, because it's really hard for her to create a grant in a silo. Being a person that's worked in grant world a lot, if the person in the front lines is not getting their input to the person who's the grant writer, there can be this huge disconnect in what needs to happen, and it can become a hot mess. So the people in the front lines, it's vitally important that you talk to them and you give them your input before, so that she can write the grant in the right way that it makes sense with, and then you don't end up with a bunch of things that you have to do, deliverables, that don't make any sense and that you can't deliver them. So everybody, if you have reports to you, people that you have any kind of, not control, but whatever, and you can prod them, really, please do that, because if you're not getting back to Christy, she's lost.
And I will sick Francie on all of them.
I can be a bolt.
No.
Yeah.
So anyway, there's going to be changes to that document, or I would have forwarded. So once that's there, I'll get that to you, Harvinder. If you could make this larger and focus on the top of it, I'll be fast here.
Is this good enough?
Yeah, that'll work.
Almost.
Move it
So-
over.
I don't know that you will be able to see everything, so we'll just start
Just need Lake.
from the lake. Lake is the 5th one down. And I would just want to point out a couple things. Red is not good, green is good.
But
So,
we did really well with the adolescent will care.
Oh, yeah, we did them the last 2 months of the year. This is this year.
Yeah, this
Okay,
is through our halfway.
We know.
Our halfway point for 2018.
Okay.
So these are claims that have been received at the end of June. Now, if you provided a service at the end of June, there's a potential 90-day claim lag there, although they seem to come in pretty quickly. We're pretty
They do,
confident
and-
there's maybe, 2% that float out there beyond a month, I mean, it's small.
Yeah.
But anyway, I just wanted to point out, we've done a lot of work when Beth was at Public Health, working with the Warner Clinic and the Lake Clinic on the developmental screen. So stop right there. Lake has the lowest percentage compliance in that area right now. And I just want to point out that we had grant resources that came around the clinics throughout the region. Angie Curtis and then Nora Zimmerman. We got the little kits that helped people demonstrate, that the kids could do those things with the, the buttons and the stuff, and got that out. And we've always struggled to meet this, and as a CCO, we're almost ready. And if you look at a place like Harney, which is at 86.1%, and they were already there the last month's reporting period, it's because it takes, and we've been working on this for 5 years, it takes that long for stuff to change in the system in order to be able to make this stuff happen. So there have been efforts here, there just hasn't been traction yet for some reason on that, and it's very likely that we're going to meet this measure as a whole, but again, it takes some time to do that. Lake is also in the good for the emergency department utilization, which is good. Now we even have more resources to go with it, but you can see that mental health is, we're starting to lose that one, so.
That's the new one, right? Which
Yep.
makes 0 sense to anyone.
Yeah, actually, if you go to the Lake page, our vendor, we'll go to that one next. The colors in, go ahead, the colors in the mental health category were wrong on that page, but they should be right on this one. We're still doing fine in mental health in Lake.
Yeah, I was surprised to see that in the red because it seems like mental health is doing so well locally. They're so busy and they're meeting so many of those measures about the turnaround and all the rest of that.
Yeah, so if you want to stay to the left, Arvinder, we still need 90 adolescent well care visits to meet the measure this year.
Wow.
We've got activities in place coming though, right?
Yeah, so the other piece on that is actually today I just pulled this very same progress report and we ran a mail merge to mail out mailers to those families again to try and get that going again. Part of what happened is I lost 3 providers, 2 of them have been replaced, and so that getting them in place and on board, one of them was our provider champion for that project, so we had a pretty big setback, but we anticipate coming back here in the next few months.
Childhood immunizations were at 40.9%, 9 of 22 eligible people who are turning 2 during the calendar year. Colorectal cancer screening, we only need 34 more for the fit kids. I think we've been working on colorectal cancer screening for a number of years, and at first we didn't make the measure, now we're making it, and I think once these systems are in place for distributing the fecal blood tests and people are walking through Nolan the colon and doing all that stuff, I think it's going to be like the developmental screenings and that it picks up, but we only need 34 more there. Dental sealants, 49 more. We've always met that measure. Advantage is on top of things. I think the key for them, as well as with Alana from our last meeting, is access to kids in schools. And I don't know whether Mary Ann and
Tiffany.
No, it was the city council guy. Darwin actually got to go in front of the school board.
No, so, and I was also going to join them for that school board meeting, and we are still discussing on a date.
Okay.
Yeah.
I still think it's a good idea that the school board hears, what these programs are about, so that they're more supportive of making some time available for the health of their students. 22 more developmental screens, 58 more effective contraceptive use. So
Yeah, and we're in the process of chart scrubbing for that also this last week, so that may.
Anyway, we're already at the end of August, so the next report, the next two reports, they're gonna be a little bit behind, but they're really gonna tell folks here what in October we really need to start to focus on to be able to meet the incentive measures, which also, again, provides the money for, that we just talked about in terms of distribution and payments for primary care. Any questions? The last item that I have is, I don't know if you have the form.
I will hand it out.
Okay, great. This is, each year, there's $10,000 available to each local community advisory council for administrative support. Basically, it's to make sure that the meetings work and run, that there's a place to meet, that there's a little snack available for the meeting or food if it was over lunch, that there are agendas sent, that there are minutes made, that there are reporting those activities to the CCO so that they could be posted on the CCO website. So there's different categories that are suggested here. I think the best thing, Arvinder, would be, well, let me back up. This document, we need to vote on it at the next CAC meeting. At the September meeting, it needs to be voted on by the local community advisory council so that we know that the CAC agrees this is what's going to happen with those dollars. And we did that last year. It needs to be reflected in the minutes, Christy. And the other thing is if there's any outstanding balance from the funds that were given last year, it needs to be reflected in the minutes too. I think you guys have spent it all. The categories here, healthy meals, meeting support and supplies, that's copies, printing, other kinds of things like that. I don't, translator for language assistance, I don't think we need that in Lake. But if we did, know that we can help you there. Health and wellness media support, that's kind of like paid media.
Okay.
You know, if you were going to do something like that. EOCCO, OHP membership engagement activities. We're supposed to be 51% Oregon Health Plan members here. It's not necessarily the case. If you were going to do things to try to reach out to them, have a luncheon meal and things like that, that needs to come out of there. If people who are OHP attend the meetings and they are officially placed on the rolls through the county court system, they're eligible for a $35 stipend for attending the meeting and mileage and childcare. That money is outside of this. So this is just trying to do outreach to our members is what that is. The FT stipend for LCAC meeting coordination, that's the agenda, that's our vendor's position. And then some people have used their LCAC coordinator to also pull together the primary care clinics. In the case here, you only have two really, three if we're dealing with North Lake as well. It's a little easier to kind of pull it together than 16 different practices in Pendleton and 10 different ones in Hermiston where, you know, that just getting those people to come to the meetings, and not the LCAC meetings, but like a meeting of the clinic managers, you know, in August is when they're starting out and saying, here's the data, what are we going to do to make sure that Umatilla or Malheur County gets up to speed on meeting the measures. Because when you see those numbers that we looked at, you know, the 58 more for effective contraception or something like that, I mean, it feels doable, doesn't it?
Yeah.
So, I mean, that's what's changed in the format of the reporting that I think is way better than here's what percentage you are.
Yeah.
It's so like now we got 90 adolescents that we have to run through.
Well, and we know which ones they are.
Yeah, we know
It's not a guessing game.
Right, it's
Yeah.
not a secret. And then the other expenses category, I can't remember if we budgeted anything for Oregon Health Authority meetings. They have had at times statewide CAC meetings, and they're usually in the valley. And they also have the Innovation Cafe, which happens in May, and I actually think it's a pretty cool thing. It's like a lot of little vignettes, 30 different vignettes on what other people are doing in order to meet, like, say, the immunization rates or something like that. So you can budget, travel for that or training for this CAC. I think the grant CAC did, invested some to have somebody come in and do trauma-informed care training for, their LCAC, so people were aware of what it is and could take it back to their organization. But if you could just run through what we did last time, and see if there's any difference, and then, we'll bring it to the next meeting for a vote. But it gets submitted and the check gets cut at the end of September. Sorry for that.
Sorry, I'm sorry, I didn't know you were done. I just got an email for a housing workshop conference, Gobi's on it, and it happens this like fall or something.
In October.
In Portland?
Yeah, is it $150?
I don't know, I didn't notice that.
Yeah, I got the same.
Are you go, I didn't know if somebody was
I was
going
very interested in going
to
to all that.
represent
Yeah.
something.
Yeah.
Okay, so as long as somebody's going, I just wanna see.
Yeah.
Okay.
I had a question, Paul.
Please.
So like Francie and Janine, they work on the Living Well programs.
Yep.
And so they were trained to be the facilitator for that program. So can we use funds from this support dollars for a future facilitators trainings, or would that align with this?
Well, that's not really what the intent would be there, except, I see what you're saying, but you have a separate opt-in grant that's supporting the Living Well program. So this is just for administration,
Okay.
not necessarily, if the broader training, I see what led you to that.
Yeah.
The broader training would be a group kind of experience for the LCAC, not an individual who's receiving some sort of a certificate to be able to do something further.
Okay.
So we'll just know that that's there. We got to deal with it next meeting because you'll be afterwards, and we'll just make sure. It's pretty easy, really.
Yeah. Perfect. Thank you, Paul.
Mm-hmm.
I'm just looking at the date for the next CHIP meeting. It's kind of later than I thought.
No, it's the 13th.
Yeah, but that's still like 3 weeks from now. I was thinking it was 2 weeks from now. Yeah, anyway, so the next CHIP meeting is gonna be on September 13th.
Okay.
Does anyone have any questions or comments about the things we discussed?
I just, I want to emphasize it. It's going to go fast again. And, as Christy said, there's going to need to be little groups of people that are doing things. The LCAC application, this group is going to need to endorse in its minutes as well. It certainly helps to have letters of support for the opt-in grants for any other organizations that are going for things. And it's really kind of hard to just only do all the business that you need to do one time a month.
Yeah.
So please remember that when the people who are grinding through stuff are trying to get things done, and especially if you're as successful as you guys have been in getting, additional grant dollars, and go from there. So if we need to have something in our dinner, let me know. I'll try to be in on video or come down if we're needing to, work a day to figure out what we want to do once the guidance comes out.
Well, thank you for that.
Yeah, can I add one thing, because we didn't really do updates? I didn't see this in the minutes, I know it happened at the last coalition meeting. It was very exciting to have representatives from class come over and announce that they were going to hire a full-time person for the Energy Assistance Program here in Lakeview.
Yeah. They are.
And that's going to be a big difference for us, and that person will be cross-trained to refer and coordinate among a number of the other class programs there, although they won't, necessarily do them. But and they also asked, class also asked that some members from our community or on our coalition would help with that hiring, be part of that interviewing board, which we thought was a really good thing because it was kind of like a recognition that, our local people needed to be have a piece of that they had struggled with the people that they have sometimes hired in the past. And since we talk about upstream, I thought that was really good. The more we get the news out, as soon as that position gets posted, we'll get it up, we'll get it around, we'll see if we can get some really good person that's local that's going to be really committed to that, because that is so important for our community, and we struggled with it last winter. So, yeah.
We at Lake Health District are also welcoming a new VISTA volunteer for the next year to help us with the opioid tracking and that piece of things that we kind of started with the Oregon Medical Board and the PMIT group, but we actually have available. We could have two, but we're going to start with the one. It was difficult to find somebody that wanted to come hang out with us in Lakeview for a year. But Liz will be joining us on the 31st, so we're excited to have her and help. I know we're just starting to kind of track that opiate use metric, but we've been tracking it here for 10 months, so we're looking forward to expanding that to all of our providers.
Cool.
It's September 4th for us. There's two VISTA sites that start a little later, so she's supposed to be in town-ish on the 31st, but I had an email from VISTA today, just so we don't have to worry about rushing.
Not have to worry about that laptop request I put in today.
Does anyone else want to give any updates? Judy?
Things are going well for us. Yeah. You know, school starting, school exclusions coming, flu season's coming. Lots of busy time coming my way. It's
Yeah.
all good.
No measles here yet?
Yeah, not that I know of.
Not in our
Not
clinic.
that I've seen. Yeah, no, yeah, you never know. No, everything's going great for us. The transition's going pretty smoothly. You know, we have a few little hiccups, but they're workable. We have some of our staff that will be coming over here and working a little soon, I think. That's kind of a hard transition for people. We're kind of a nice little home, and it's hard to go to the big scary world when you're used to our little home, you know. And I love change, and I just have to realize other people don't. And seriously, take that to heart and realize how anxious that is for them, because it's not for me. So if you see any of my staff walking around, tell them hi, welcome them like you all would.
I forgot to mention, I had one other thing. On September 22nd, we'll be doing Head Start physicals at the Lake Health Clinic. So we'll close down from 2:30 to 5. We have all 40 kiddos come through and we decorate and hopscotch rug and whatever to make it fun. So we'll be doing that in September. Cool.
So you said Head Start physicals, that's going to happen in the Head Start?
No, it'll happen here on site at Lake Health Clinic. So we close the clinic down to regular patients during that time.
Okay.
And we run the kiddos all through. We have different stations. And
Do they bus the kids over here so they can get here?
the parents are responsible for bringing them. Historically, we've done it before school starts, but they have a new director. I don't know if she's new last year or this year. But she actually suggested waiting until after school started this year.
Is it a requirement of attendance at Head Start that you go through a physical?
Yes.
Okay.
Yes, it is. And so I thought they had to have it before the first day, but that is not the case. Whatever that requirement period is, we fall within that for this date. And so anyway, when they touch base with the parents for their home meeting, then they'll sign them up for a time slot I think if they have a problem transporting a child, they would let Head Start know, and I think they help them facilitate that. But they will all be coming on site, usually mom and dad or one of the other come with them.
Thank you. Diane, do you want to share any programs which we are not aware about?
Not at this time.
Right.
I was hoping we could do more for the seniors eventually, but they don't have the funds to run their buses all the time.
We did give them a memorandum of understanding to help with that from a project that we had, just as a stopgap. And they've got a new program with the Lake Health District that is also, should have turned that around. So that should be a lot better than it was.
Oh, good, yeah, because like I said, right now, some of the seniors, you know, if they want to come to lunch and don't have transportation, you know, they're SOL.
And this has been going on for,
For a couple of months now.
okay, so before they
Yeah,
had?
yeah.
Okay.
Yeah, so we need some extra funds to help with that because I can only do so much of it.
So Paul,
And
we
then
can
I'm
use
not
the
really
funds-
legal probably, but you know.
We can use the funds for,
Admin for that? But there is an opportunity that I shared with Chrissy, but I'm not sure how innovative it would be, unless you
Yeah.
linked it to social isolation.
We could do that. It might also support that villages program. That's
Yeah.
kind of what I've been eyeing it for, but I need to go through the RFP a few more
Yeah.
times.
Okay.
And I think the food share program is going to be doing better. They're working on, right now, the food pantry works out of the, yeah, the building uptown.
Lakeview Ministries?
Pardon me?
Lakeview Ministries? That-
Yes.
Okay.
Yeah, that building. And we're trying to get them all into one building so that we can work together better and the hospital is cooperating, I understand, because they own the building and they're going to be doing some remodeling for us and so I hear. I haven't been to a board meeting yet, but I intend to. For the hospital. I'm on the food share boards and
yeah.
kind of one of them, you know, last to know part. So I'm gearing up to try to find out without losing tempers.
Thank you,
But-
Diane.
So, yeah, so I'm hoping it's gonna work out really well, and then, like I say, with the seniors, if we can just get more funding mainly for the general bus trend, you know,
Yeah.
trend, yeah. Because, I know, like I say, my neighbor lady, I just found out today that, she couldn't get her car door open. You know, she didn't have the strength. So she couldn't come to lunch or exercises because she had no transportation. And I don't know how many others are out there like that. So it'd be something maybe that senior center can work on, but anyway, if anybody has any ideas of where to get funding, that would be great. So,
Thanks for letting us know for that. Yeah.
Yep.
So thank you, everyone, for coming for the meeting. So we'll adjourn the meeting now.
Good, thank you.